Si a sorti nan kay nan le a toujou. Mbap ka paret nan bel madame. So man ki me di moutou la paske ba yo.
Well, the healthcare system in Haiti is near collapse, and these are not just my words. These are words that have been mentioned by the United Nations, as well as words that have been backed by deeds that have happened in Haiti just this year on the health sector in Haiti. And that has been highlighted just this week with an attack at the Bernard Meves Hospital in Port-au-Prince. And that is what I'm going to tell you about today, exactly what happened at the Bernard Meves Hospital in Port-au-Prince and why this was a very important hospital that should not have been touched by these gangs or the Haitian National Police or anyone and should have been left to continue serving the people in Haiti. Well, this is Bonafide. If you haven't subscribed yet, kindly subscribe and hit that notification button so that when I release something new on Haiti, you get notified as soon as possible. Well, the Bernard Meves has survived the earthquake, the 2010 earthquake that happened in Haiti. The hospital has also survived kidnappings, it has survived gang violence all this time and political upheavals in Haiti. But this very hospital did not survive the Molotov cocktails that were thrown at it just at the start of this week. And that meant that the full operations of the hospitals have been halted because of the gang violence that happened near that hospital and has affected the hospital because these gangs went on to burn the hospital and continued to do atrocities against that particular hospital. But in this video, I want to speak about the exact thing that happened and what led to the gangs to react the way they reacted against that particular hospital. Well, let's start with the location. The Bernard Mev Hospital is located just at the entrance of a locality that is controlled by the gangs. So the location or where this hospital is placed was a disadvantage to it at this particular time, as we are saying that 85% of Port-au-Prince is under gang control. So that just tells you that a lot of these resources are either in gang control or near gang control. And that also happened to affect the Bernard Meves Hospital that happened to just be at the border point of the territories of this gang control. And when I'm talking about the gangs, this particular gang is allied to the Vivan Sam. So we'll be just mentioning the Vivan Sam as a whole gang that affected or attacked the Bernard Mev Hospital. Now, as it turns out, as it is usual for the gangs, they want money out of any resource that is operating within their territory, and the Bernard Meves was just within their periphery. So they wanted some kind of a bribe for them to continue operating in that territory. Notably, there have been threats against the hospital, and that is the reason as to why the hospital officials saw it wise, together with the security operators in Haiti, they saw it wise to remove patients from that particular hospital and move them to other facilities across the country because of the threats of the gangs that were looming. And the gang leader had even said that they will attack the Bernard Mev Hospital. That is the reason as to why there are fewer casualties, because the state, the Haitian government, took that initiative to make sure that all patients that were in that hospital have been moved to other hospitals across the country. But primarily, this hospital, even after moving these other patients, was used to take care of the Haitian police when they are injured or when they are shot in these crossfires with gangs. So the Bernard Mev Hospital was still a very vital hospital for the police officers and to some point also for the gangs. Whoever wanted care, the hospital doors were opened for them to go and seek care. But these gangs wanted some kind of a bribe so that they can be able to get some money from that to pay their gang members. As I've said time and time again, these gang leaders see it very, very important to pay their gang members. Because if you don't pay your gang members, it is possible that you are going to have an internal conflict that will not augur well with that gang. So that is the reason as to why there are these desperate moments where the gang leaders will go to the full extent so that they can get money to run their gang activities. And that, in part, is what has happened or has caused these gangs to attack the Bernard Meves Hospital. They wanted a bribe, but the Bernard Mev Hospital or the staff there say that they are not going to pay a bribe for these gangs. They are not going to be part and parcel or to support gang activity in Haiti because they have seen the effects of gang activity. And that stand now made the gangs to go after them, to go and start fighting and throwing Molotov cocktails at critical facilities in the hospital, making the hospital to lose critical equipment that could only be found there in Haiti. Well, the gangs did not just give that reason as the main reason as to why they attacked that facility, that being one of the top reasons. Another reason was the fact that just previously there was a war. As I started by saying, this is a hospital that was at the borderline between the safe zone and the gang control areas. Now, there was a fight by the gangs against the Haitian National Police that has been happening in different places where the gang territories end and the government control areas start. Now, another reason that the gangs gave as their purpose to go and attack this hospital was the fact that after there was an engagement, an exchange of fire just last week, and the police officers overpowered the gangs, they tried to flee, but they could not flee over the hospital fence, and that led to the capture of many gang members and the elimination of several other gang members. And that did not sit very well with the gang members, and that made the gang now to take action against the hospital because of the fence that could not allow many of the gang members to escape the Haitian National Police. Now they had to, in their own reasoning, they had to attack the hospital, the entire hospital, and make the entire facility to be redundant because they could not escape the attack that they waged against the Haitian National Police. Well, there are many other reasons. If you try to wrap your head around it, you'll find that there are many other reasons that the gangs could have used to attack this critical facility. But it is important to know that this was the only neurological center in Haiti. There was no any other neurological center in Haiti. A hospital that was serving a population of 12 million people plus now is up in flames. Critical facilities that could not be found anywhere else in Haiti are now gone and cannot be serviced or cannot help anyone because they have been raised in flames by these Haitian gangs. The gangs that many people call revolutionary now are attacking the resources that people are supposed to use when they are sick. Simple operations like appendicitis and other operations cannot now be conducted in Haiti because of this violence that has been waged against this critical facility. Notably, the largest public hospital in Haiti, the State University Hospital, is not operational. Even as the security apparatus tried as much as possible to secure that area, the State University Hospital is not operational. That is the largest public hospital in Haiti. Other hospitals are also not operational because of gang threats. And it is also important to note that just recently, the Doctors Without Borders say that they are not going to operate anymore in Port-au-Prince because of the scare from the Haitian National Police that they are threatened, that sometimes they are working under duress because they don't know what will happen next after they were attacked by the Haitian National Police, who demanded that they should have two of their patients who are perceived gang members. Then they went on to execute two of them. So that is the problem that is facing Port-au-Prince right now. There are very few hospitals operating, if any, in Port-au-Prince, and they don't have that special medical facilities that could help many of the people in Haiti. Quite a number of people in Haiti are losing their lives right now because of rather simple illnesses that could have been prevented or been treated. For example, diabetes, people are losing their life because of lack of insulin. These are medications that could be easily gotten from hospitals, from different even dispensaries, but they are not operating because of this gang violence that is now showing to be increasing as days go by. And these critical facilities are being razed down without regard by these gang members who don't want to picture their future nor their future of their kin, because they are destroying the critical facilities of their country. Well, the gang violence in Haiti just shows the extent to which these people will go, these criminals will go to fight the government or anyone assisting the government of the day. And even the firefighters that were present at that particular place wanting to extinguish the fires that were raising down the building were shot at and they could not be able to save the facility or the equipment that was there. And that just shows the sad reality of what is happening in Haiti. Although the MSS is arming up to fight the gangs in Haiti, the Haitian National Police are also doing their part. There is still more that needs to be done in Haiti for it to be secured, for it to promise the Haitians that life will be normal again, that the medical or the health sector will be normal again. A lot will have to be done. A lot of investment will also have to be done, a lot of lobbying if possible, so that all this will return to normalcy. These are, for example, what happened in Bernard Meves, that is 30 years worth of work, worth of investment has been lost in just 2 days of an attack by these gangs. So that shows the kind of expense that now Haiti will have to incur so that they could return back to normalcy.